Other thing that the left dorsolateral prefrontal cortex is exquisitely positioned to do, and this is beautiful work of a colleague of mine by the name of Nolan Williams, also in psychiatry, is because of its connections to some structures that then feed into the vagus nerve, it actually can slow the heart rate down. So in other words, let's say someone says something and your immediate impulse is to fight or to respond in a kind of knee-jerk way. If you halt, right, I guess what the meditators and the mindfulness folks was called the gap, or if you can access some memory and think, and you might be thinking, actually there's a much better way to place the dart if I just kind of lean back a little bit, or it could be, silence might be the best response, right? Or it could be that you're going to carefully access some data from your hippocampus to respond in a way that is most effective. For instance, here I'm talking about confrontation, but it could be any situation. The left dorsolateral prefrontal cortex does two things. As it acquires a new rule set or starts to access information about a new or possible rule set, it also sends a parallel signal to slow the heart down through the vagus nerve. And that is, I think, one of the more important and fascinating discoveries in the last 5 years. Those aren't data from my laboratory. I wish they were. But it's very clear that when we start accessing alternate rule sets, there's a signal that quiets the body in some ways and position.
Is that partly how you calm yourself down?
That's right. It is how you calm yourself down. And again, you have the clinical background, not I. But I'll confess I've been in therapy enough to know that occasionally, one feels as if you're accessing some piece of info as the patient side. I can only report from the patient side. Accessing some what feels like important piece of information. You're pulling on a thread of some sort, but then the therapist will say something, and it literally gives you that alternate view. And this notion of looking at things through a different perspective, we often think about that as a switch in our cognitive frame, in our thinking. But also, we now know there's this parallel signal that's sent to the body in which, in order to access these alternate rule sets, new ways of looking at things, there's a calming signal literally sent to the body as well. And I find this conversation fascinating because normally we just think about anxiety and exploration and rule setting and rule responses or responses to rules, et cetera, as a kind of the body sends signals and the brain does all this, what neuroscientists have always talked about as top-down processing. Right, just sort of suppress the hypothalamus, control the limbic system.
Right.
And that's true to some extent, but there's also, it's clear there are signals being sent to the body in parallel. And rather than look at the signals...
It's more like conducting than suppressing.
Exactly.
Like conducting, like an orchestrator conducts.
Exactly. And there's a very interesting phenomenon that takes place in people that have chronic anxiety, or for people who essentially stop accessing alternate rules and responses to these signals. And this is, I think, what is showing up in chronic anxiety, certainly in certain forms of depression, and when people enter states of rage and dysregulation, is that normally we know based on neuroimaging that the prefrontal cortex is essentially leading the response of this anterior cingulate cortex and the insula. So information is coming up from the body into the insula and then being fed to the prefrontal cortex. But then the prefrontal cortex is actually in a position to lead responses. And it essentially is acting like the coach of a team. And the team is all these structures like the ACC and the anterior cingulate cortex and the insula, the heart rate and so forth. What happens in individuals who have chronic anxiety or damage to the prefrontal cortex or dysregulation of these circuitries is that order actually reverses. The insula and ACC start leading and directing the response of the prefrontal cortex. And I think, we see this I'm sure you've seen this clinically in individuals. And while this isn't necessarily a discussion about society at large, we see this in dysregulated arguments and dysregulated combat where people is essentially losing themselves and they default to what appears to be very primitive rule set